I think we're still waiting for a couple of our panelists to get on, but I will just acknowledge the fact that I am dressed in costume. We at Central Office, and particularly the Communications and External Affairs team, really lean into Halloween and believe very much in doing what we can to be spooky. And also, you'll notice that my office reflects this vibe as well. There are actually witch hats hanging from the ceiling. I've got my cape on. I've got my witch hat on. I've eaten like 4 Reese's peanut butter pumpkins, so I am ready to go. So we do have Brett on here as well. So I think that we are in a good spot to get this started. So welcome, y'all, to our Lunch and Learn on Therap. We wanted to do this for you all because, as you all are aware, Therap is a major process that and a process change and a system that we are implementing in DIDD amongst DIDD and our providers. And there are a lot of different work streams going on. There are a lot of different phases going on. And while you might be involved in one or none, everything kind of is intertwined, and you might not know the entire process and where we are. So we wanted to give you all an opportunity to hear what's going on with Therap and be able to ask questions as employees of some of the folks that are working on this project. We are committed to doing these lunch and learns on more topics, just like the MAPS one, this, so that folks really have the opportunity to learn about some of the things DIDD is up to and get to ask questions of some of those who are making some of the decisions. So with that, I'm going to turn it over to our Deputy Director of Program Operations, Kim Black. She is going to be running this presentation. As always, drop some questions in chat if you've got them, and we'll get to those at the end. And we've got Brett Wendell, who is SPS supporting DIDD and is the head of that for DIDD, and we are very excited to have him on here as well. So hopefully we'll have a great lunch and learn. Kim, take it away.
All right, good afternoon, everyone. I almost said good morning. So I'm the lucky person that's gonna get to talk to you this afternoon and just kind of give you an overview of where we are at with Therap implementation. So today we're going to go over the vision, goals, a summary of the schedule, and we'll briefly discuss the work streams that are being developed and just talk about some of the next steps with Therap. So our vision with Therap is, so we're really excited that Therap is going to be a major component of integration. IDD services.
Give me 1 second.
Oh, okay.
Sorry, Kim. We're going to switch it from presenter view to the view that people can actually see it in full screen.
Okay. So while they're doing that, just yeah, Therap is going to be a major component of, or we hope a major component of integration as we move to integrate IDD services across the state of Tennessee to a single seamless person-centered system. We're gonna attempt to bring the majority of our DIDD business processes into alignment, eliminate duplication, and improve service delivery overall. So the goal was to secure a system that's gonna supply our network with an electronic means that's gonna aid us in our goals. Next slide. As we move to a single seamless person-centered system, Therap, we hope, will help us streamline processes, including expediting our service authorizations and claims, provide the benefit of access to data-driven outcomes that will ultimately benefit people supported, as well as providers, ISCs, and our own staff. This access to Therap is going to be provided to our network at no cost to providers and ISCs. The huge draw to this system was the ability to look at data that can tell us if outcomes are being achieved. This is going to be important as we move towards value-based reimbursement, which is going to reward our provider network, our providers, ISCs, and hopefully even down to the DSP level for achieving quality outcomes. And by doing so, we can improve service delivery and just, again, gain efficiency across the network by standardizing our processes. Okay, next slide. So here you can see a summary of our schedule. So on the left-hand side, you can see the modules and the work streams that we're working on, and we've got target dates associated with all of those. So we are already into phase 1 of EVV. We implemented that back in January of this year, and that is for providers providing personal assistance and respite services. So they are required to check in and out for scheduled visits for providers of that service. And that same is going to be true for nursing, therapy, and behavior services providers coming very soon. That is phase 2 of EVV. We have already rolled out nursing. We're doing a phased rollout. So we started with nursing in October. Therapies is going to go live November 1st. And then behavior services on December 1st. And then by January 1, which is the deadline for the federal mandate, we'll already have everything rolled out and everybody should be used to using it at that point. Also for January 1, 2023, we're gonna be implementing phase 3, or we're implementing it now, but we're gonna go live with phase 3, and that is to link EVV usage to billing, and that is going to be required to come into full compliance with the federal mandate. So in the past, we had Sandata as our previous vendor. We're moving over to Therap, obviously, but we really have left it up to the provider. We have in our compliance plan that you should not bill for any visits that do not have a corresponding EVV visit. But this phase is going to allow us to electronically verify that that has occurred before the provider is able to bill. Case management, we are in the middle of a pilot right now. That started 7/1/2022. It involves ISCs, providers, our plans reviewers, case managers. And so what's happening there is the PCSP is being created and viewed inside of Therap. So we are testing out eliminating the Word document format that we use for creating the PCSP. It can be stored inside the system along with all the supporting documentation. So we're trying to really cut out that manual process. So beginning 3/1/2023, that's when we intend to go live with the rest of the network outside of just those that were chosen to participate in the pilot. And so we'll talk about this a little more in detail in a little while, but training is going on right now, trying to bring everyone up to speed so that we can be ready to start this on 3/1. We are working on billing. That is set to go live. We don't have a firm date yet, but that's set to go live in the third quarter of 2023. Billing is going to move from PCP into Therap. We had been working on an assessments module for our individual experience assessments and individual employment data sheets. We have a tentative go live date of January 1st, 2024. And then reportable events management, or REM, that is currently on hold. Next slide. So just a little bit about EVV. We've been using EVV since 2019, I think. And so we know that this is an electronic means of staff at provider agencies checking in and out for their scheduled visits. And so we're required by federal mandate to document the precise time when services begin and end. And this is just to ensure that people are getting the services that they're authorized for. And it's a way to combat fraud, waste, and abuse. So we want to make sure that the person actually got their services where they were supposed to get them, and they occurred during the appropriate authorized time period. At this time, EVV for self-directed services is going to continue to operate with time for care. So those with PPL as the fiscal intermediary, they're going to be outside of the scope of Therap right now. So this is our non-self-directed services, PA and respite, and Katie Beckett's supportive home care as well, that are going to be involved in this EVV Therap implementation. Next slide. Case management. I talked about this a little bit when we were going over the summary, but essentially this is where the PCSP is going to be created. That's the terminology we're trying to align. As we're aligning, we're used to calling it the ISP, but we're moving to calling it the PCSP, short for Person-Centered Support Plan. So the ISC is going to create this in the Therap system, and it can be viewed by supporters in the Therap system, even down to plans review, being able to approve it in the system. So really, we're trying to replace the manual processes and, even if possible, like manual storage on shared drives, and just make it more efficient. So case management is going to allow, in addition to the PCSP and the supporting documentation, there's going to be other information in the system about the person supported that's going to kind of drive services. So all entities supporting that person are going to be able to see that information in this work stream or in this module. That's going to be recorded in a variety of ways in the system, through case notes, which is a method of documentation of service delivery. It can capture health information, daily notes. Therap has what we call ISP programs and ISP data modules, which is where those kind of data-driven outcomes that I spoke of are going to be captured. Some of this is going to be later down the line. Right now, we are really focusing on getting the PCSP process down and the approval process down. But all these things are going to come later. Also, secure communications can occur within this module, and we call that SCOM, and that's the internal email system within Therap. So supporters can communicate about the PCSP inside the Therap system, and may no longer need to do that via email. Next slide. Billing. All providers that currently bill in PCP are going to be required to bill in Therap. There's been some confusion about who needs to use Therap, and so if you're a provider and you bill for services, that means you're going to need to use Therap. So that is all providers. So if you get those questions, then that's how you answer that. So Therap is going to allow linking of service documentation, EVV claims, ISP data, case notes to the billing. So when the provider goes in to bill, there's got to be information to support the billing. So all that will link it in the system and allow for just better efficiencies. Next slide. Assessments and screenings, which I said we've kind of got January 2024 as the target date for this. We were going to go live a little bit earlier, but we really needed to tweak some things and really wanted to focus our resources on billing and some of the more important modules because we have a process for this now. So this isn't the focus now, which is why the target date is so far out. But the individual experience assessments and the employment data sheets are eventually going to be captured inside the Therap system in the assessments module. And so but some benefits to that is we're going to have all that data in one system, and ISCs, case managers, and even our staff are going to gain efficiency there because you'll be able to see everything in one system, whereas it's not quite that way today. Our staff that are overseeing will just have access to the data, and tracking, trending, and reporting is going to become much easier. Next slide. Reportable events management. This work stream is on hold for the foreseeable future. But this would have been the module where reportable events were going to be tracked and incident reporting was going to be monitored. So that is on hold right now. Next slide. Some other work streams that we're working on provider management, and this is really kind of a I don't want to say catch-all, but that's, for lack of a better term, catch-all for this is all the modules that I spoke of. These provider management issues that don't fit into those other modules, that's what we're working on in this work stream. And the provider usage is going to begin during the account setup. So there'll be setup of the provider, whether it be a new provider, sites, programs that the provider is providing. This is where access and privileges that'll be assigned to certain roles is going to occur. Administrative processes, this is where the password policy is going to be configured. So think about this as an administrative module for providers, and we'll have some access to this at the oversight level. DIDD is going to have an oversight account, and providers will have their be able to manage their accounts at the provider level as well. Next slide. There is a data and interfaces work stream that we have our STS and business analysts working on, and that just deals with the different data feeds and data migrations. And again, it's kind of an administrative place. Their state oversight accounts are going to be configured there, and that's what the IDD staff are going to have access to and be able to see in the system. The IDF is what we're calling it, where person-supported demographic information is going to be dealt with in this module. That IDF is coming from the TennCare system. That's the source of truth. So that's something that they've worked on in this work stream. That's going to be where we deal with the provider directory, provider onboarding, site onboarding. That is the different locations that providers are providing the services and rates. So a lot of this is going to have to come from a source of truth, and that is what is being dealt with in this work stream. It is quite complicated. More on data, there will be a provider aggregator. You may have heard about this. There was a presentation on this on the 12th of this month that Therap did. And essentially, the goal of the provider aggregator is that when billing begins, providers that wish to basically maintain any electronic system that they already have in place, we're going to call them third-party systems, they'll be able to keep those in place and interface with the Therap system so they can keep what they're doing and comply with our requirement that they use Therap for billing. So providers, let's see, are going to still need to maintain a Therap account, even though there'll be an aggregator. It's going to focus more on billing. So in order to see that PCSP in the case management module, the provider is still going to be required to use Therap, even if they're maintaining a third-party system. Next slide. Some of the expectations for the provider, aggregator, are that their vendors, once we have the aggregator model in place, can begin preparing their technical environment immediately. They're going to have their own vendor develop an interface for that system to connect with Therap, so that responsibility is going to lie in the provider's hands. And again, the provider is going to have to log into Therap. So there'll be, like I said, for the PCSP case management component, and there'll be some account administration that they'll have to do in Therap system. So again, if you get those questions, even if a provider has a third-party system, we still do require all providers to use Therap. And this is just some information. I believe we're going to send this PowerPoint out after the meeting. And so I know that staff get questions. And so this is just information for providers that are interested in the aggregator. We're going to have them contact Therap in order to let them know that that's what they want to do. They'll be required to sign a legal agreement, and Therap is going to schedule each provider and vendor individually so they can talk about what specifications are needed. There's more information about the provider aggregator on our DIDD website, and this is the link, and you'll have that when you receive the PowerPoint. So wanted to briefly talk about maybe some of the challenges we are experiencing related to implementation. This is a complex project. There are multiple stakeholders involved, including DIDD. We have STS, who is leading the project management efforts. There's Therap, InCare, providers, ISCs, clinicians, and even the MCOs in some aspect are stakeholders. So that makes it complex within itself. And then with all the business processes that we have in place here at DIDD and all of the divisions that this could potentially affect, it just continues to add layers. And then in some cases, we have asked for customization in places so that we can, try to get there more closely aligned to what we're doing today. And so that, can result in some delays based on, it just takes time to do the development. And so we're trying to avoid customization and just take the system as it is as much as possible, unless we have to do otherwise. Other challenges, we've got IDD integration happening at the same time. So we've got business processes changing outside of Therap, but we're also defining what that looks like inside of Therap. So it's kind of, I like to say, we're building the plane and flying it at the same time. And so that can be, because, we have to business has to go on every day, even though we have these initiatives. So that can make it complex. And then as we get into more of the implementation, we've got requirements gathering, and maybe there was something we didn't think about, or we didn't think about how it linked to this other process. So that impacts the scope of what we're doing and timelines as, we discover new things in the work stream. And then I've already talked about customization requests. So just so you're aware, our MCOs, UHC, AmeriGroup, and Blue Care are not part of the initial implementation, although we do have to consider some of their business processes and some of the things we're doing, like billing, for instance, but they're not going to be, for instance, in the EVV implementation. This is not going to involve ECF staff, and their PCSPs are not going to be in Therap right now. So that is a down the road initiative. Other challenges, we've got some uncertainty regarding our CMS approval for integration. And, there's new rates that come with that, and new services, and all of that stuff has to be configured into Therap and be ready to go once integration is approved. So it's kind of, just putting a hold on certain things because, we don't know when we're going to get approved. Next slide. Some unintended consequences that we've encountered, or that we are going to encounter. We have some providers that are already using Therap, and so they are likely going to experience some changes due to DIDD having state oversight. There are going to be some guidance and policy changes. Right now, they have their own accounts and they can use it how they want to. But we do have some guidance around, let's see, the way they set up their sites and programs. And so that's going to have to change for them. And I think we have some providers right now that are using Therap to store their PCSPs, but that's going to have to change because, that's going to come from the ISC, and there's a whole process associated with that. So there'll be some changes for them. And then there's a password policy, so that may be different for providers. And I'm not going to, these blue hyperlinks, they hyperlink to the password policy. So you'll have that when you get the PowerPoint. I'm not going to go over that right now, but we do have a defined policy. And then I talked about the individual demographic forms and how that interfaces with TennCare system as the source of truth. And so one of the unintended consequences there is that the address of the person is controlled in the TennCare system rather than directly in Therap. So you can change the address in Therap, but whatever is in that TennCare system is going to revert back to that, because there's a data feed there that updates. And so until that address gets changed in the TennCare Connect system, it'll continue to, not be updated in the Therap system. And there is a process for changing that in the TennCare Connect system. That went out in open line probably about a month ago. It's on our website, and it's also on the Therap website. So there's a link to it in this PowerPoint. Next slide. So some of the next steps with providers, and some of this is happening now. We're going to start engaging providers in phases and using the system before billing goes live so that they can get familiar with the Therap system. So what Therap is offering right now is the use of T-logs, which is a staff-staff communication tool. health tracking, which is kind of self-explanatory, but all that health-related information for individuals is going to be captured there. And then we talked a little bit about SCOMS earlier, which is a PHI protected email system within Therap that will allow supporters to communicate inside the system. So that information about that has been running in open line as well, and it's voluntary at this point. So providers that want to go ahead and get used to that have been asked to reach out to Therap. Next slide. So we're allowing some of those providers, like I said, to reach out and let Therap know that they want to participate in those additional modules. We're also targeting EBV users since they're already in the system and offering them those additional modules. Another group is the pilot providers. And then following that, we'll get the broader group of providers that aren't really using any of the other modules, aren't involved in the pilot, and may just be kind of waiting on, what they need to do in Therap. So the target time frame for, training these different groups of providers is mid-October through December. That actually started in, I think, October 17th. And so, like I said, that's voluntary. And then towards the end of the year, early January, we're going to reassess, see who hasn't been trained, and reach out to the rest of those providers to get them using the system, because we don't want the first time the provider has used Therap to be when they go to bill. Next slide. The training approach for providers is going to be like a two-part process. They're going to have account setup and configuration. That always occurs one-on-one with Therap. And then training, Therap has called it asynchronous training, is going to occur following that. So they have lots of tools on their website, handouts, videos, recordings. And so that those providers will be provided with that information for the second part of the training. And then I mentioned that weekly webinars started October 17th, and they're running through mid-December. And providers have been provided with a registration link. It's been going out in open line for the last 2 or 3 weeks. Next slide. Same thing, next step with ISCs. I will say ISCs are very heavily ingrained, the ISC leadership in the PCSP pilot, like really going through every single line of the PCSP and, saying, we wish, this worked better, we really need this, down to, we wish we had a button here for approve or delete. So they're very ingrained in that. But the rest of the ISC network needs to be brought up to speed. So once the pilot is over, which I believe at the end of this month it will be over, there's going to be mandatory PCSP training for the rest of the ISC network. And then starting March 1st, we're going to start requiring that the PCSPs be developed in Therap. So the PCSPs that are entered into Titan already are going to be allowed to live out their lifespan in Titan. So what that means for our staff is that there may be some dual work going on until we're fully implemented into Therap. So if the due date, so March 1st is when we're going to start requiring that, but that's pre-planning for those ISPs that are due in July. So really July of next year until the following year, we'll have plans both in Titan and in Therap. Next slide. And so as far as next step with our DIDD staff, we need to continue to identify what roles are needed, who needs access to Therap, what role do they need in Therap. There'll be a train the trainer model. So right now we have EVV, Office of Business Services, admin services, plans review, case managers are involved. We're bringing in the transitions unit, and QA staff are having some demos coming up. But the suggested model for train the trainer was to have a designee in each unit that is going to be using Therap to be the designated trainer and provide support and training to their unit. So we'll have to make decisions on who that will be. And just business processes are going to likely need to change to adapt to the new system. Again, that's going to be an opportunity to gain efficiency and standardize processes across the state. And so we really want to avoid just taking what we already do today and trying to make it fit in Therap. Therap is already set up to do what we needed to do, and other states are using Therap successfully. So we want to try to avoid asking for customization so that we can do exactly what we're doing today. We want to really take advantage of this opportunity. And so there'll be more about that coming as we continue to peel back the layers and see what we need as far as staff and our business processes. As far as communication, we've been sending out a lot of information in open line via listserv, to the providers. I need a drink of water. Sorry about that. So we'll have weekly updates in open line from now on about just what's happening with Therap so we can keep everybody up to speed. And there'll be some things in DIDD Connect as well. We're planning on doing a provider survey to just get the landscape of the technical requirements or just what technical specifications they already have in place and gauge what they need. And then there'll be more webinars coming up just as we learn more.
Kim, let me jump in here for just a second, just so that you can clear your throat. If you guys have any suggestions of any types of communications that you think would be helpful to you all, or any kind of documents that would be helpful to you all as far as you guys, many of you all getting accustomed to it, or anything that you're seeing already through the pilot, just shoot it my way. We're open to ideas. Sometimes the best communications come from people that are not me. In fact, oftentimes the best ideas come from people. Communications ideas come from people who are not me. So just let us know, and we'll definitely consider that, because you all play a part in helping make this successful, and making sure that you all feel informed is important.
Thank you, Kara. It's a good thing we are almost at the end, because I've seemed to have gotten choked up here. I'm so excited about Therap, it's just getting me choked up. So these are some resources here for you. We, providers received some training on the PCSP, the pilot providers, and we recorded that. So it's on the Therap website. There's a link to it here. Therap does have a Tennessee support page that kind of gives a summary of some of the things I talked about here today, with time frames and just links to different videos and stuff that may support, if you want more information about the case management module, you can find that on the Tennessee support page, for example. and on their Therap site in general. We've got one dedicated to Tennessee, but all their, like if you want to know what they're doing in other states or just receive some sort of training, that's there. We've got a DIDD Therap support site, thanks to Kara and her team, with information on there, and including the information I was talking about with the providers today. So with a provider aggregator, we're going to continue to add to that as we learn more information. And then we have our EVV for community providers page, where we've got our compliance plan there. And this is, specific to those PA, respite, supportive home care, and our clinical services providers who are using Therap for EVV right now. Next slide. And then just contacts, we've got our EVV support email, and that's dd_evv.obs@tn.gov. The underscore is hiding in there. We've got our Therap support website, and providers and ISCs have been using that, from what I understand. So Therap will take your questions, and if they're DIDD specific, we're asking if you have questions about DIDD specific things or the implementation. Alex Gone, who's our DIDD program alignment director, she is listed on the website as the contact, and she can triage the concern and get you to the right place. And then for IT support, we've got Brett Wendell, and mostly that's going to be questions related to the aggregator. And I don't know that our staff will have questions about that. But he's available to do that. And of course, I didn't put my email address here, but you can contact me as well. Kimberly.j.black@tn.gov. Don't forget the J. And that is all I have today. So we've got a little over 15 minutes for questions.
Okay, so we do have some questions. And yes, you guys cannot see the hats hanging from my ceiling, but they look like this. Also, Natalie, please put your camera on and show people what your office looks like.
Oh no, the black is falling. Hold on, let me.
Oh my God. Okay, well, some questions, and then you'll get to see what Natalie's office looks like. Because let's be honest, her office looks fantastic at all periods of time. Okay. Will all DIDD staff have access to the DIDD oversight account? Kim, not sure if you or Brett would be the best person to answer that question.
I'll try to answer, and Brett, feel free to jump in. I don't think so. I think that, as with anything, it's going to be on a need to know basis. So a person that really doesn't need to be in there won't have access to it. And then even for those that do have access to the oversight account, everybody won't have access to the same things. It's based on what your role is. And so that's one of the things we've been working to identify as user roles.
Okay, awesome. I think the next question is Brett, if you're on here, which I know you are, I'm going to have this one go to you just because it seems like it's a customization question. For DIDD staff who have access, does customization include downloading documents from Therap, downloading PCSPs, for example?
Kara, thank you. Yes, the Therap, the customizations that have been done so far do include the ability to download the PCSP. It's got the option to export that as a PDF. If other documents, there are certainly also options to download those and export those as well. But if there's a specific concern, feel free to reach out to me and we'll get research specifically to that point.
Okay. I do not see any other, here's one. Billing, would providers who need to bill DIDD.invoicing also be converting to billing through Therap?
That is a good question. I think that's one that we're going to have to do a little bit of research on. There's a subset of providers that bill through the DIDD.invoice process. I don't believe they will, but we'll make note of that question and come back with some answers.
Awesome. I do not see any other questions right now. Anyone have any questions? I don't want to shut it down too early, but if you have, I'll give it about enough time for me to wave my broom around. Okay, I don't see any questions, which means, Kim, you must have done a great job covering everything in the presentation. We are doing a similar presentation for providers next week, just because they obviously are a big part of this, as you heard, and making sure that they feel aware and in tune. But we wanted to make sure that we had, we talked to you all first, because we all want to make sure that everybody's plugged in and knowing what we're going to and what we're doing. So with that, I hope everybody has a wonderful Halloween. And for those of us who go all out, you know, be excited for us, because we like this holiday. So talk to you all later. Thank you so much, Kim, Brett, and Jordan, for being on here. And we'll talk to you all later. Also, if you guys have any ideas for any lunch and learns that you all would like to hear about, shoot an email my way and we'll get that on the schedule as well. Talk to you later. Bye.
Thank you.
Thanks, everybody. Great job, Kim.